Imagine this: you're doing everything right. You're meticulously taking your medication, you're diligently watching your diet, and your blood sugar numbers are, on paper, stable. Yet, despite all your efforts, you feel worse than ever, an inexplicable, bone-deep fatigue that no amount of rest can cure, a persistent brain fog that makes simple tasks feel like climbing a mountain, the unsettling sensation of numbness or tingling in your extremities, and even heart palpitations that send a shiver down your spine. You've probably shrugged it off, attributing it to your diabetes itself, or simply resigning yourself to just getting older. But what if I told you that the real enemy isn't your blood sugar, and it's not merely the march of time? What if it's a silent, invisible thief systematically depleting vital nutrients from your body, making your diabetes far more dangerous and robbing you of the vitality you deserve? This insidious thief is often tragically overlooked by doctors and patients alike, its subtle depredations dismissed as mere symptoms of the disease. And here's the crucial part. This overlooked threat is particularly prevalent if you're taking one of the most common diabetes medications in the world, Metformin. I'm Dr. Michael Bennett, a nutritionist with over 20 years of experience, and today, we are going to pull back the curtain and expose these unseen threats. We're not just going to talk about the 3 vital vitamins you thought you knew about. We're going to dive deeper, revealing the hidden minerals and powerful compounds that could very well be the missing link to truly reclaiming your health, energy, and zest for life, even with diabetes. We'll show you exactly why these nutrients are critical, what happens when you're deficient, and most importantly, how to fix it, often with simple, accessible changes you can start implementing today. This isn't just another health video. This video could literally change the trajectory of your diabetic journey, transforming the way you feel and function every single day. So, do yourself a profound favor. Hit that subscribe button right now and join our growing community committed to true holistic wellness. Because it's time to stop just managing diabetes and start thriving with it. 1. The Metformin connection. Vitamin B12, your nerve's best friend. Let's kick things off with the #1 silent saboteur lurking in your diabetes medication: vitamin B12 deficiency, often directly linked to metformin. If you're one of the millions taking metformin for type 2 diabetes, listen up, because this could be the most important part of this video for you. Metformin is a powerful and effective drug for managing blood sugar, and for many, it's a lifesaver. However, its effectiveness comes with a little-known side effect that can subtly, yet significantly, undermine your health. It actively interferes with your body's ability to absorb vitamin B12 in the small intestine. Think of it like this: your intestines have tiny gatekeepers responsible for letting B12 in. Metformin, without directly attacking B12, makes these gatekeepers less efficient, effectively lowering the amount of this crucial vitamin that gets into your bloodstream. And the consequences, they are far-reaching and deeply unsettling. Have you ever experienced persistent tingling, numbness, or even burning pain in your hands or feet? This is often dismissed as diabetic neuropathy, a direct complication of high blood sugar. But for many, it's a screaming symptom of B12 deficiency, exacerbating or even mimicking nerve damage. This isn't just discomfort, it's a decline in your quality of life. Beyond the sensory issues, B12 deficiency can manifest as profound muscle weakness, a troublesome loss of balance that increases your risk of falls, and a debilitating brain fog that makes concentration and memory elusive. You might feel perpetually exhausted, regardless of how much you sleep, or even experience symptoms of depression and anxiety that seem to come from nowhere. Remember Sarah from our intro, feeling inexplicable fatigue and brain fog despite stable blood sugar? For many like Sarah, the hidden culprit is vitamin B12. Why is B12 so important? It's absolutely essential for the health of your nervous system. It maintains the protective myelin sheath around your nerves, allowing them to transmit signals efficiently. It's crucial for the production of red blood cells, which carry oxygen throughout your body, directly impacting your energy levels. And it plays a vital role in DNA synthesis, the very building blocks of every cell. Without adequate B12, your body simply can't function optimally, and diabetes only compounds the problem. So what's the solution? Firstly, if you're on metformin or experiencing any of these symptoms, talk to your doctor immediately about getting your vitamin B12 levels tested. This is not a luxury, it's a necessity. Secondly, while supplementation is often necessary for those on metformin, prioritize dietary sources as well. Think of powerhouse foods like beef liver, clams, salmon, and other fatty fish. Poultry, eggs, and dairy products also contain B12, though plant-based sources are limited, making fortification or supplementation crucial for vegans. When it comes to supplements, look for methylcobalamin, which is the active, more bioavailable form. A typical dosage might range from 1,000 to 2,000 mcg per day, but it's absolutely paramount to discuss the correct dosage with your healthcare provider. Do not self-prescribe. Addressing this one deficiency can profoundly improve your energy, nerve function, and mental clarity, giving you a powerful tool in your diabetes management arsenal. Next up, let's talk about the sunshine vitamin that could be the missing key to your insulin sensitivity and mood: vitamin D. You might associate vitamin D with bone health, but its role in diabetes management is far more profound and often underestimated. The reality is, vitamin D deficiency is incredibly common, particularly among individuals with diabetes, due to factors like reduced sun exposure, higher body fat, which sequesters vitamin D, and darker skin tones. So, what happens when your body is starved of this seemingly simple vitamin? For someone with diabetes, the consequences can be particularly severe. Low vitamin D levels are strongly linked to increased insulin resistance, meaning your body's cells become less responsive to insulin, making it harder to control blood sugar. This can lead to higher blood pressure, an elevated risk of heart disease, a major concern for diabetics, and even exacerbate mental health issues like depression and anxiety. Many people also report persistent brain fog, a general feeling of sluggishness, impaired kidney function, muscle weakness, and an increased susceptibility to bone fractures. It's like your body is constantly battling an uphill struggle, and vitamin D is the silent ally that's missing from the fight. Why is it so critical? Vitamin D acts almost like a hormone, influencing hundreds of genes and cellular processes. Crucially, it plays a vital role in regulating insulin secretion and improving insulin sensitivity, essentially helping your body use insulin more effectively. It also helps regulate blood pressure, supports nerve protection, and has a significant impact on mood and overall brain function. Imagine your insulin as a key and your cells as locks. Without enough vitamin D, that key just doesn't fit as well, making it harder to unlock your cells and let glucose in. The solution here, again, starts with awareness and testing. Ask your doctor to check your 25-OH-D levels. When it comes to sources, natural sunlight exposure is ideal, but often insufficient, especially in winter months or for those who spend a lot of time indoors. Incorporate fatty fish like salmon, mackerel, tuna, or cod liver oil. Some mushrooms, specifically those exposed to UV light, are also good plant-based sources. For supplementation, consider vitamin D3, the form your body naturally produces, and here's a pro tip: pair it with vitamin K2. Vitamin K2 ensures that calcium, which vitamin D helps absorb, is directed to your bones where it's needed, rather than accumulating in your arteries. A common suggested daily intake is at least 2,000 IU, but again, always consult your healthcare provider to determine the right dosage for your specific needs. Boosting your vitamin D levels can significantly improve your blood sugar control, support your cardiovascular health, and lift your mood. Let's delve into vitamin E, your body's internal anti-aging shield against diabetes' silent damage. Diabetes, by its very nature, creates a state of heightened oxidative stress within the body. Think of oxidative stress as tiny, aggressive rust particles called free radicals, constantly attacking your cells, especially your delicate blood vessels and nerves. This continuous assault is a primary driver of diabetic complications, leading to accelerated aging and widespread damage. When your body lacks sufficient vitamin E, this powerful antioxidant, the consequences can be dire for a diabetic. Your blood vessels become more prone to stiffening and plaque buildup, increasing your risk of high blood pressure, heart attack, and stroke. Your eyes become more vulnerable to diabetic retinopathy, a leading cause of vision loss. Nerve damage can worsen, and your body essentially ages at an accelerated rate from the inside out. You might find yourself experiencing more pain, more fatigue, and a general decline in your physical resilience. Why is vitamin E so important? It is one of nature's most potent fat-soluble antioxidants. Its primary job is to neutralize those damaging free radicals, protecting your cell membranes, DNA, and, crucially for diabetics, your cardiovascular system from their destructive effects. It acts like a bodyguard for your cells, especially those lining your blood vessels, keeping them flexible and healthy. By reducing oxidative stress, vitamin E helps mitigate many of the long-term complications associated with diabetes. So, how do you ensure you're adequately protected? Focus on getting vitamin E from whole food sources. Excellent options include sunflower seeds, almonds, hazelnuts, spinach, and wheat germ oil. These foods provide a complex of tocopherols and tocotrienols, which are the different forms of vitamin E, all working synergistically. When considering supplementation, look for the natural form, D-alpha-tocopherol, which is more bioavailable and effective than synthetic versions. A typical suggested dosage might be around 400 IU per day, but this should always be discussed with your doctor, especially as high doses can interact with blood thinners. Moreover, actively avoid processed foods, trans fats, and excessive refined sugars, as these can contribute to oxidative stress and hinder vitamin E absorption. By shoring up your vitamin E defenses, you're not just managing symptoms. You're building a crucial shield against the silent, insidious damage that diabetes can inflict over time. Now, let's venture beyond vitamins to the critical minerals and compounds your doctor might be missing. While the big three vitamins we just discussed are vital, there's a whole orchestra of lesser-known, yet equally crucial nutrients playing pivotal roles in your diabetic health. First, let's spotlight magnesium. This often overlooked mineral is a true workhorse, involved in over 300 enzymatic reactions in your body. Shockingly, more than 50% of individuals with diabetes are deficient in magnesium. The consequences of this deficiency can profoundly impact your daily life. Are you plagued by muscle cramps, especially at night? Persistent fatigue that just won't quit? Perhaps you struggle with anxiety, irritability, or difficulty sleeping. These are classic signs of low magnesium. But beyond these overt symptoms, magnesium deficiency also contributes to increased insulin resistance and higher blood pressure, directly undermining your efforts to control diabetes. It's crucial for proper glucose metabolism and the healthy function of your nerves and muscles. Without enough magnesium, your cells struggle to utilize glucose effectively, and your body's energy production falters. To address this, load up on magnesium-rich foods like pumpkin seeds, spinach, almonds, avocados, and black beans. If dietary intake isn't enough, especially with diabetes, supplementation might be necessary. Look for highly absorbable forms like magnesium citrate or magnesium glycinate. Always consult your healthcare provider for the appropriate dosage. Next, let's talk about chromium, a trace mineral that acts as the insulin enhancer. While research is ongoing, evidence suggests that chromium deficiency can render your insulin less effective. When insulin can't do its job properly, your blood sugar levels rise, making weight management and overall diabetes control a constant battle. Chromium is believed to enhance the activity of insulin, essentially helping it unlock your cells more efficiently so glucose can enter. It's like a key that helps your actual insulin key work better. You can find chromium in foods such as broccoli, grapes, beef, and whole grains. For some individuals, a supplement might be considered, but it's important to do so under medical supervision, as excessive intake can be harmful. Then there's alpha-lipoic acid, ALA, a potent antioxidant and the nerve protector. Diabetic neuropathy, that painful tingling and numbness in your extremities, is one of the most debilitating complications of diabetes. ALA is a powerful antioxidant that helps combat the oxidative stress that damages your nerves. It also shows promise in improving nerve function and even enhancing insulin sensitivity. It helps regenerate other antioxidants in the body, such as vitamin C and E, making it a master antioxidant. Foods containing ALA include red meat, organ meats, spinach, broccoli, and potatoes. However, the amounts found in food are often lower than what's used therapeutically for nerve protection. Supplementation, particularly with the Republican Alabama form, which is the body's natural form, is often recommended for those with or at risk of diabetic neuropathy. Again, discuss the right dosage with your doctor. Finally, let's highlight omega-3 fatty acids, the ultimate inflammation fighter. Chronic inflammation is a hallmark of diabetes, acting as a slow burn that damages blood vessels, contributes to insulin resistance, and increases the risk of cardiovascular disease, kidney dysfunction, and widespread tissue damage. Omega-3s, particularly EPA and DHA, are renowned for their powerful anti-inflammatory properties. They help quell this chronic inflammation, protecting your cardiovascular system, supporting brain health, and even benefiting your eyes. Excellent dietary sources include fatty fish like salmon, mackerel, and sardines, as well as plant-based options like chia seeds, flax seeds, and walnuts. If your dietary intake is insufficient, a high-quality fish oil supplement can be incredibly beneficial. Look for supplements that provide substantial amounts of both EPA and DHA. So, how do you know if you're actually deficient in these critical nutrients? The only way to truly know: your personalized nutrient blueprint. While the symptoms we've discussed are strong indicators, they can also overlap with other conditions or even be subtle and insidious. Guessing with supplements is not only ineffective, it can be potentially harmful. The most crucial step in taking control of your nutrient health is to test. Don't rely on symptoms alone. Talk to your doctor, armed with the knowledge from this video, and specifically request blood tests for vitamin B12, vitamin D, 25, OH, D, and magnesium. Depending on your symptoms and specific health profile, your doctor might also recommend tests for other minerals or discuss the benefits of supplementing with compounds like ALA or omega-3s based on your dietary habits. Beyond testing, your action plan should include a commitment to a whole food, nutrient-dense diet. Prioritize abundant dark leafy greens, clean proteins, healthy fats, and limit refined sugars and processed foods. This holistic approach, combined with targeted supplementation based on your test results and doctor's advice, is the powerful formula for truly thriving with diabetes. Remember, always consult with a qualified healthcare professional before starting any new supplement regimen, especially if you are on medication. Your health is unique, and personalized guidance is key. So there you have it. It's now undeniably clear that managing diabetes goes far beyond just monitoring blood sugar levels. It's about empowering your entire body with the critical nutrients it needs to thrive, to truly heal and function at its best. We've pulled back the curtain on the silent threat of B12 deficiency that often accompanies metformin use, revealing its profound impact on your nerves and brain. We've unearthed the insulin-boosting, mood-lifting power of vitamin D, a true secret weapon for sensitivity. We've discovered the anti-aging, vessel-protecting shield of vitamin E, defending your body from oxidative stress. And we've shone a light on the unsung heroes like magnesium, chromium, alpha-lipoic acid, and omega-3s, each playing a distinct yet vital role in your energy, nerve health, and overall cellular function. By understanding and proactively addressing these often hidden deficiencies, you're not just passively managing symptoms. You are actively preventing severe, life-altering complications, boosting your energy levels beyond what you thought possible, sharpening your mind for greater clarity, and truly reclaiming a vibrant, fulfilling life, even with diabetes. This isn't about quick fixes. It's about sustainable, foundational health that empowers you for years to come. Now, don't let these unseen threats continue to sabotage your health any longer. Take control today. This is your moment to shift from just coping to truly conquering your health challenges. Here's your immediate action plan. Step 1. Don't keep this life-changing information to yourself. Share this video with every single diabetic you know, especially those on metformin. You could literally be the catalyst that changes their lives. Step 2. Take the initiative. Schedule an appointment with your doctor and talk to them about getting your nutrient levels tested. Be specific. Ask for B12, vitamin D, 25, OH, D, and magnesium levels. Step 3. Start implementing the dietary changes we discussed. Prioritize nutrient-rich whole foods and consciously reduce processed foods and refined sugars that steal your vitality. And please, If you found this information valuable, if it resonated with you, if it gave you even one new piece of insight, hit that like button right now. Your likes help us reach more people who desperately need this knowledge. And don't forget to subscribe to my channel for more cutting-edge, actionable health insights that empower you to live your best life. What other diabetes challenges are you facing? What topics would you like me to cover next? Drop your questions and comments below. Your engagement helps us create more impactful, life-changing content. Remember, knowledge is power, and your health is your greatest wealth. Take that power back. See you in the next video.